Thank you, Prime Minister. The COVID pandemic, as I've said in Parliament and I've said since, is going to lead to a significant economic shock to Jamaica and to the world. World growth is projected to decline significantly this year, and no doubt Jamaica as an economy that's connected to other economies will be affected. In addition, as we've seen, we expect that the robust employment figures that Jamaica has been enjoying will experience some kind of interruption as a result of this crisis. What is important, however, is that the crisis is temporary in nature. By definition, it is brought on by a pandemic that requires persons to restrict their movements and for economic activity to be curtailed. And therefore, it's not related to any structural imbalances in any particular economy, but to the effects to counter the pandemic. So we want to make sure that when you have a crisis that's temporary in nature, we want to make sure that we have a response such that temporary problems don't lead to permanent, a temporary crisis doesn't lead to permanent problems. And that's why the government is responding in the way that it has, with a care program that is geared towards keeping employees connected with their employers, and where that is not possible, supporting employees who have become disconnected. The platform for an intervention of this nature doesn't exist, because Jamaica has never had to, or never been in a position to intervene at the scale we're considering intervening in this way, in a discrete basis where individuals can apply and receive transfers, receive benefits. As a result of that, the systems are being built and designed now. Most of the intervention will take place via an online platform where persons, either through their mobile phone or through a computer, will be able to access, and small businesses and businesses in general will be able to access the system, will be able to put their data, upload their particular data, and importantly, we will require a verification. At the end of the day, this is taxpayers' money, and it's money coming from you as a taxpayer, and you will want to ensure that your funds are going to persons who indeed have been affected by this pandemic, and your funds are being directed first and foremost to the persons who are most affected, the sectors that are most affected, and then out from there. So the verification process will be an important part of it, and having people upload online will make verification easier. We'll have a call center that will be available. Persons can call a number and get responses to their questions and get help with filling out the online application form. These applications the online platform, which your fellow Jamaicans in the Ministry of Finance, in Accountants General's Chambers, in Tax Administration Jamaica, working alongside the professionals at eGov Jamaica, are working to put this platform in place. They're working around the clock, this online platform, and the platform should go live on April 9th, and you will be able to apply for one of the programs that have been outlined. We want to be in a position where we can have a quick recovery. There's no doubt that as we learn more about, as Jamaica makes strides in containing the virus and the world learns more about the science of it, this shall pass. And when it does, we want Jamaica to be among the first who can bounce back and have our economy and our economic activity resume levels that it has had or up until this crisis. Very importantly, supporting our small and micro businesses is a key part of our strategy. We have had a very robust growth and birth of small businesses in Jamaica as individuals get comfortable with risk and taking risk. We've had a large increase in the persons borrowing to start new businesses, and for that reason, we're very keen to support those micro and small businesses. So we encourage them to apply online when this facility becomes available on the 9th of April. Thank you, Prime Minister.
Thank you, Minister of Finance. And I again just wanted to reiterate a point that the Minister of Finance made, that Jamaica has never had a platform that would allow it to intervene in a time of crisis in such a discreet way, meaning intervene on an individual level to ensure that the benefit of the government intervention actually gets to the persons who are targeted for the intervention. So we have intervened in mass ways for groups, but the beneficiary targeting systems have never been precise, and therefore in between what the government intends to deliver versus what actually gets to the citizen, there is oftentimes a gap. And our fear, of course, is that once that gap exists, then there is room for all kinds of misdirection and misallocation of resources. So we are learning from the experience of the past, and we are definitely going to try our best to ensure that whatever support and stimulus that is provided, that it goes from the government to the beneficiary that is targeted, and it is not dispersed in ways that would not yield the results that we would want and for the rightful beneficiaries to get. So the Minister of Finance has just given the overview. The details, of course, will come when we go live with our online platform. As an aside point, we also discussed putting the NIDS on a faster track to implementation. It is clear that if we had the national system of identification, then it would be far easier for the government to provide this kind of individualized benefit system that would be to the benefit of all. The truth is we now don't have that system. We are behind in its implementation. We still have new legislation to bring to the cabinet and to the parliament, but we cannot waste a crisis. Now is the time when we really need to have the system, and we're going to move as quickly as possible within the boundaries of the laws and constitution to ensure that every citizen of Jamaica has a unique identifier that will be able to ensure that whatever benefits that come from the government will go directly to them. So we also spent some time clarifying the various orders that have been issued, and the Attorney General is here with me, and the Minister of Local Government is here with me, beautifully decked out in his pink shirt. So he will be joining me shortly to explain some of the orders. I have seen persons sending around videos, and I have received the complaints that some of the entities which have been exempted from the gathering regulation, that is the 10 persons gathering, have been conducting their operations in such a way that it defeats the very purpose of the orders, which is to ensure that there is no spread, general spread of the virus. So we're seeing businesses having long lines outside where social distancing rules are not being abided by. People are closing doors and only taking in 10 at a time. Let me give an overview, and then the Attorney General could give further explanations. The rule regarding gathering is an absolutely important rule. It reduces the probability of spread of the disease within a population. We have decided to go with a moderate rule. There are other countries that have very stringent rules, down to 3 persons can gather in close proximity at any one place. We have kept ours at 10, and most countries seem to be gathering around that average of 10 in terms of what their orders would look like. We have exempted some businesses, some entities from this general gathering rule of 10 persons. Some exempted entities would be the market, for example, markets, supermarkets, pharmacies. We had said gas stations earlier. We had said financial institutions and the tax office and the customs office. It doesn't mean that they are exempt from the social distancing rule or from the requirement to practice the sanitization rules, the hands, sneezing in the elbow, the use of tissue, not touching your face. Those rules still apply. What we are saying to operators of these entities, people who manage these entities and people who use services provided by these entities, is that within the space that you are going to be occupying, you must ensure that everyone is at least 3 feet apart. If I were going into the space, I would want to be at least 6 feet apart. But that's just me. But the requirement of the order is that you are at least 3 feet apart. And the persons who are managing these entities should at all times put in place the systems that would be having a surveillance of the space to ensure that this is maintained. Persons operating this space should ensure that there is, for example, a hand sanitization station, that there are napkins available or tissue available for persons to use. These kinds of provisions to ensure that the space is maintained in such a way that it is not an area in which there is a high probability of spread. So, for example, supermarkets, no need to only take 10 persons at a time. Look at your floor space and see how many persons could fit within that floor space without violating the minimum 3 feet apart, and put in place the necessary hand sanitization stations, the signs, and these other things which are important in ensuring that we maintain the essence of the order. Attorney General, if you would want to join me to give further explanations.
Thank you, Prime Minister. My fellow Jamaicans at home and abroad and friends of Jamaica, we continue to be in challenging times. We are monitoring and managing a crisis that is unprecedented. I would like to just use the opportunity to say that I see the debate is raging in the public space about the constitutionality of the measures that we have taken. Be assured that debate is also taking place internally within the government. I want to let you know that for every action we have taken, especially as those actions relate to the rights of our people, they are limited to containing the spread of this contagious disease, and they're also limited in time. So let the debates rage, but be assured that those of us who are here in government, especially the Prime Minister and his team, we have to take actions in real time to deal with issues that are unfolding before us. We don't have the luxury of sitting down and getting into niceties, but we must carefully consider what we're doing and be assured that is what we have done. Just to say again that at this stage we have opted to utilize the Disaster Risk Management Act, and that is because this is a multi-sectoral crisis that we're facing, and we took the view that it requires a multi-sectoral approach. And at this time, the 2015 Disaster Risk Management Act is the newest provision we have on our law books that enable us to deploy all of government in addressing the issue. Prime Minister has promulgated the disaster risk management enforcement measures, and we have been clarifying those measures. He has pointed out that we are restricting movements because the medical experts tell us that that is critical to containing the spread of the disease, and so the quarantine rules are designed that way. The rules in relation to social distancing and staying at home are also measures that are directly related to containing the pandemic, the crisis that we're facing. So we have the general stay-at-home rule that if you can work from home, you should do so, and this requires an assessment within organizations of the duties that are assigned to each employee. And we continue to say work from home if you can, because the science tells us that everyone has a role to play, and the biggest role is just to stay home, stay out of the way of being at risk and being at harm. So we have also looked at those who are most vulnerable, again, informed by the data provided by the medical experts. So we have vulnerability by virtue of age and vulnerability by virtue of underlying conditions. We have addressed specifically the age issue in the order promulgated by the Prime Minister, and we have asked persons who are 65 years and over to work from home where they can, and we have asked persons who are 75 years and over to stay home for a period of time. And these prohibitions are part of our way of discharging our responsibility to you and to ensure that you are protected as best as circumstances permit. Prime Minister has indicated that we have, for practical purposes, accepted a number of establishments and categories. And even though we have not specified that those who are exempted are mandated to keep the social distance rule, as at this time, I can only reiterate what the medical experts are saying and what the Prime Minister has already said, that in order to contain the spread, we must maintain distance. If it becomes necessary, we will mandate it. So right now, we are, as we assess, we will escalate up as the need arises and as we are advised by the experts. Be happy to take any questions in due course. Thank you.
So I'm going to invite next the Minister of Local Government to give further clarity and to seek the cooperation of several of our entities which fall directly under the supervision and regulation of the municipal authorities.
Thank you. Thank you, Prime Minister. Good evening, ladies and gentlemen. First of all, the questions have been asked about the operation of gyms across the country. This is an area where a lot of people gather for early morning exercise right through the day, and it is an area of great concern. This is now an official appeal to the operators of all gyms across the country, that we are asking that operations be toned down in order to comply with some of the measures that the government is putting in place as we respond to the virus. There are other places of public concerns, parlors and other open spaces where we continue to see large gathering. The municipal corporations have been instructed to close all public parks, to restrict access to public parks across the country, and we are calling on Jamaicans to accept and to work as we try to contain the disease across the country. the Minister of Finance gave an indication of the support that is being contemplated for certain sectors of the country, and some critical areas that falls under the Ministry of Local Government will benefit once we have worked out the protocol surrounding how these benefits will be passed on to those who will qualify. Barbers and hairdressers, owners and operators of bars and vendors in our markets. There are criteria that will be set out as to how you can access these benefits. And once we have worked out those criteria, we will be putting in motion the system in order to facilitate this operation. Just quickly, Prime Minister, I want to make two announcements that is of importance. Commencing on Sunday, we will begin feeding of our homeless population across the country. We will be providing on a daily basis a breakfast between 9 and 10 a.m. every day, and dinner between 2 to 4 o'clock every day, commencing on Sunday. The corporate area, which is the largest constituents of that street population, will be operating out of several locations. In Crossroads, we'll be operating out of the Carib Car Park, in New Kingston, Grenada Way, in Halfway Tree, the Bethel Baptist Church, and the car park at the KSAC, the Kingston and St. Andrew Municipal Corporation building in downtown Kingston. So this feeding program will complement what we are presently doing in the other parishes where our drop-in facilities are providing daily meal and supply for persons living on the streets of the country. We are now working assiduously to find a location which we intend to put in motion early next week, where we can take some of these persons off the street, especially in the corporate area, on a temporary basis. Local government is critical to community development, and the councillors play a critical role in this fight against the COVID-19. And therefore, the government, through the Ministry of Local Government, will be making $140 million available to be used amongst councillors. These funds will be used under specific guidelines that is set out by the ministry, along with the Ministry of Finance and the Ministry of Health. And the details of those programs will be worked out, but the benefits of this program is to reach those in the various communities across the country who are affected by what is taking place. So again, let me urge my fellow Jamaicans, especially the operators of public gyms and open spaces, that we are now asking that you come on board and with immediate effect tone down or cease operations in these areas. Thank you.
Thank you, Minister. Just to reinforce, particularly, we've been getting many complaints about the operations of gyms. And, you know, it's a delicate balancing act. We're encouraging people to still get their exercise. Exercise is important to building immunity, but gyms in particular are places where you have to share surfaces, and you possibly are operating in very close quarters. So gyms will be under the surveillance of the Ministry of Health to ensure that they are maintaining the social distancing, that they have the necessary sanitization practices to ensure that there is no spread in those areas. And if, having reviewed their operations, we form the opinion that we are not getting the cooperation necessary, then we will adjust the order as necessary to ensure that there is no spread. We are walking on a tightrope. We are trying to keep the economy going along, and we are trying to prevent the spread of the disease. We can only do both if everyone cooperates, and that's really the key message. There's been a lot of questions about testing and our testing capacity, and why are we not testing like other countries are testing. I'm going to invite our CMO, who was explained already, but to explain again and to give a further update. CMO?
Good evening, everyone. Okay, first, since I'm standing here, I just want to say a word again of recognition to our healthcare workers. I want to commend, in particular, the teams that have been on the ground doing the contact tracing, really and truly in all the regions and in almost all the parishes. They have been doing a tremendous job. They have been out there going from home to home, interacting with quite a broad section of the community. And I just want to thank the people of Jamaica for assisting them in their work. I just want to reach out also to the hospital staff. I know that a lot of them are feeling a lot of pressures. We have patients admitted who are suspected and confirmed cases in quite a few of our hospitals at this time. And I know that the staff is pressured in terms of managing personal protective equipment, in managing all the news that is around them, especially where we are seeing that healthcare workers right across the world are being affected severely and having severe outcomes in this global outbreak. So I just wanted to assure them that the Ministry of Health is procuring and to ensure that all the necessary protective equipment is in place. We have done our survey of the hospitals and of the regional health authorities, and we still are maintaining that we do have personal protective equipment in place. In speaking to some of the departments, I realize that there may be some shortage of communication between the different departments and the stores. So we have asked for this to be corrected so that the departments can be adequately supplied with equipment. I just want to say a word in terms of the Bull Bay community that is being released from quarantine this evening or tonight. I want to remind the citizens of Bull Bay, as the AG had mentioned, that the general rules are still in place. So therefore, there's a general stay home as much as possible. Limit your chance of being exposed to someone who is ill, and protect your elderly relatives and limit their exposure. Protect the persons in your families who have chronic illnesses. You protect them by staying at home and limiting your own exposure and the possibility of bringing home the virus to them. Stay at home if you are ill and contact the health department if it is that you need to have any kind of assistance or you have any concerns about your illness. Anyone that has traveled must stay home for the next 14 days. If you develop symptoms, call the health department. Wash your hands frequently and maintain a 3 to 6 feet distance from persons. Continued surveillance is going to take place in this community over the next 4 weeks. So therefore, our healthcare workers are going to be in the communities. They are still going to be visiting the homes of the persons that have been identified as close contacts of persons who would have been confirmed with COVID-19. They are also going to be present in the wider community. please report to them if you have ill members in your home so that these persons can be tested. The persons who are presently being tested, who are waiting on results, or who have other instructions to stay at home, must stay at home and complete their 14-day quarantine period. At this time, as the Prime Minister mentioned, we have a great threat from persons who are returning from countries that have very, very active transmission. And I just want to reiterate that persons who have traveled must stay at home. You must limit the risk of exposure of other persons, and staying at home will help you to monitor your illness so that you can find out early if you are developing symptoms so that you can report it, so that the necessary actions can be taken. I just want to advise the public of the changes, some of the changes that we have made in terms of our surveillance, and this is to ensure that we pick up any evidence of any kind of community transmission as soon as possible. All persons with severe acute respiratory illnesses in hospital, that is persons who have pneumonias, will be tested. These persons are from across the entire island. So once you are in hospital and you have a severe acute respiratory infection, you will be tested. All our healthcare workers who develop any kind of acute respiratory infection will also be tested. All our persons who visit our health centers and our accident and emergency department, we will be doing a sampling of those persons to determine if there is any kind of spread in the community. So not everyone will be tested, but everyone will be advised to stay home if they have any problems and to report if there's any worsening of their symptoms so that the necessary action can be taken. But a certain amount of those persons on a regular, routine basis will be tested across the country from the hospitals, A&E departments, and from the primary care facilities. In order to allow for this testing to take place, I should mention also that in addition to that, we will be testing whether symptomatic or asymptomatic direct contacts of those persons who have been confirmed with COVID-19. These measures are in addition to the testing of persons who are suspected cases. A suspected case meaning a person that has traveled to an area where there is active transmission or who have been in contact with somebody who has COVID-19 and now have acute respiratory symptoms or severe, whether it be severe or not. In order to facilitate this testing, we have expanded and we are in the process of expanding our testing capacity. We are in the process of expanding our sites for testing. At present, testing is carried out at the National Influenza Center. The Ministry of Health is working very, very hard to establish within the next 2 to 3 weeks the capacity at the National Public Health to also test. We have acquired a machine that is capable of this testing, and the installation will start this week, on Monday. The installation will start on Monday, and we are hoping that everything will be completed as early as possible to facilitate testing. And we have ordered 10,000 tests to be able to be done on that machine. This is in addition to our testing capacity at the National Influenza Center, where we presently have the capacity at this present time to do 3,000 minus the 250 tests that we have already done. This testing capacity is supported by PAHO, and PAHO has indicated that they are going to provide additional test kits, another 6,000 tests that we expect to receive in the next 2 to 3 weeks. So at this time, we do not anticipate that we have a shortage of testing, neither now nor in the medium term. As time progresses, we will continue to do our assessments and will expand our capacity as it becomes necessary. Okay. Prime Minister, I think I'll finish.
So you were going on so beautifully, CMO. I thought you had another point to make. But the CMO made some very important points, and I just want to pick up on the point about testing, because the media reports, the information that is circulating, and indeed the WHO have recommended increased testing as part of the toolkit of the government. But every government has to organize its toolkit in such a way based upon the exigencies of its own resources. So some countries may be able to have, hundreds of thousands of tests done without having an impact on the resources available to do other things, because, Jamaica does not have unlimited resources. So if we decide to focus on one thing, it could be to the detriment of others. So it's about making the priority decisions. And I believe that what the CMO has said is that we are expanding the base of testing, we are expanding the targets for testing, we are increasing the capacity for testing, both in terms of the actual tests themselves, but also in terms of the machine and the equipment to do the tests, which will last for many years. So if, God forbid, there were to be another outbreak of some infectious disease, that investment in the equipment would give us the capacity to be able to respond. So Jamaica is well covered in a strategic way for testing. And I would put it to you in this way. We have tested so far, as the Minister mentioned, 250 persons. To date, we have confirmed out of that 250 that have come to us by virtue of imported cases, contacts of imported cases, and traces done, and people who would have come into hospitals, and we have tested all of those. And we have 30 cases. Now, that's about 12%. So having tested 250 persons, 12% of that. Now, people might say that is low, but that is the result. That is what we have. And we have spent some time in cabinet with the health professionals, with the public health professionals, to say, what else can we do to make sure that we're not missing anything? And what the CMO has said is that she has tested persons as a control group within our hospitals that are reporting flu-like pneumonias symptom. And you want to tell us what the result of that testing was?
So far, we have tested 61 persons, severe acute respiratory infections in our hospitals. 60 are negative, and we're awaiting one result.
So what this is saying is that people who are in hospitals who have flu-like symptoms, pneumonia, or other symptoms of the flu, are also tested. So we're not just testing persons who we have traced for COVID-19 or who have COVID-19, but persons who have other symptoms within that general category of symptoms that are flu-like. And for the 60 you have tested, 0 results so far, 1 you're still waiting on. So it gives us a sense of assurance of what we're doing generally. But nevertheless, the science is saying expand your testing, and we are going to expand testing. Now bear in mind that getting a test today that says you're negative doesn't mean that tomorrow you can't catch COVID-19. So it does give you some sense as to where there are clusterings happening when you do tests, but the test itself does not prevent you from getting the disease. We also focused on some of the HR matters, the human resource management matters, and the permanent secretary in the Ministry of Health would want to give you an update. PS?
Thank you, Prime Minister, ministers. Over the past 2 weeks, we have been getting many requests from public sector and private sector organizations around persons who have been asked to stay at home. Now, it doesn't qualify as sick leave because they are not sick. And therefore, there's no certification that a doctor will give to you around your medical status. But you're being asked to stay at home as a function of quarantine, or you're asked to stay at home as a function of your requirement to self-isolate or self-quarantine. So the Ministry of Health and Wellness, in taking into regard this request for an HR transaction that allows organizations to verify persons who would have been required to stay at home, will be launching on Monday a system that allows persons who have been asked to stay at home to receive a special code that will also be emailed to their organization. Organizations will also be able to contact the ministry and verify whether or not persons have been asked to self-quarantine or being put in quarantine. The Ministry of Health and Wellness will also be instituting the same system for fit-to-work certification, where organizations will receive notification that an individual has completed their term of quarantine, and then they will be asked to, they will receive a document that allows the organization to verify that this person is now able to return to work. And these two mechanisms are critical, we believe, to the effective maintenance of the economic activities that we currently have in place. Thank you, Prime Minister.
Thank you, PS. So effectively, if I just to repeat quickly what you were saying, that if someone has been asked by virtue of some concern about their health status to stay at home in self-quarantine or is quarantined in a state facility, that you have now put in place an online mechanism which will become live on Monday to inform both the employee and the employer of that status. And when that status has changed by virtue of them completing their 14 days, they will also be informed virtually as well. Thank you, PS. The Minister of Education is here with us. There have been many complaints and indeed suggestions as well regarding how the food that is distributed through the Ministry of Education, the lunch program, and sometimes breakfast, how that is done, and he will give us an update as to where we are with that.
Thank you, Prime Minister. I'm not going to detain you because as I look around, I realize that most of you folks are a bit younger than I am, and my quarantine time is up. So I bet, or has just begun, I have to get back. The fact of the matter is I want to take this opportunity to thank the parents of the children who have had to stay home and the tremendous amount of effort that has been put into ensuring that they get the appropriate lessons, that they attend to their lessons, and I'm very hopeful that the results coming out of the PEP this year will see an improvement because of the level of intensity and concentration that this method that we have implemented through the internet is paying healthy dividends. I want to extend my appreciation also on behalf of the entire all Jamaica for the tremendous work being done by the teachers across the length and breadth of this country. If you can imagine the amount of pressure that they've been under since March 18th to introduce a new system and have it work as beautifully as this one has. I'm very proud of them. They continue to show the kind of quality that we have in this country in our teachers, and I have utmost confidence in them. Now, you have heard the Prime Minister mention the question of the feeding program. Well, we have heard them also, and we have listened to the people. And we have decided as a consequence that because of the journey that they had to take and the cost attendant thereto, we have decided that we would add the sum of money for the lunches and the breakfast program and the lunches to the PATH program and pay that monthly. So the parents will have the money in cash that will be passed through the regional offices and communicated to the parents. So they will be responsible over this period to providing lunch and breakfast for the students. There no longer will any boxes of lunches transported to locations where they can be collected and so on, which will be a great relief, I'm sure, to many. With respect to the holding of the PEP, as anticipated, you must realize by this that the exams have had to be canceled for this, or extended, postponed. And so the fact of the matter is that we will be undertaking them in the months of June and July, and they'll be marked in August, and the placements will be made in September. This is the same approach that we're going to be adopted, that's going to be adopted with the CXC, the CSET, and of course, City and Guilds is also looking at the same time frame, same format. The cost, incidentally, of underwriting the need for PATH students who we give a grant of $1,200 for the primary school and $1,500 for the high schools, that will be continuing during this period of crisis with the COVID. And so once that period is over, we will revert to the delivery of meals at schools to over 100,000 students at a cost of $232 million. The CXC, as I mentioned, is engaging the similar format of the PEP. And I must also indicate that in addition to what we provide, the private sector have quite generously pitched in and has assisted the ministry to provide assistance in the form of meals and so on. And also with the internet providers, they have been able to assist us greatly. 30% of the students, some near 40,000 students, don't have access to cable or internet. In those cases, they will be delivered hard copies, and as we go towards taking the PEP, it will be done through the internet, or not internet, but the computer system. And so what we will do is we are in the process of training our youngsters right now who are in those areas where there's no internet service and so forth, so that by the time they come around to taking the PEP, what will happen is that the tests will be downloaded into laptops, which they are now going to be trained over this period of time, and they will write the examinations based on the information given to them, provided to them through the not laptop, but tablets. And in this regard, we have made provision for some 4,000 tablets to facilitate this process. But in addition, what we have discovered is that the children are responding so positively to this system that when they go back into the classroom, I'm sure that the teachers are going to be amazed at their dexterity in the use of tablets and the use of electronic equipment. So we have quite of necessity transitioned into the use of technology in our educational system, which is the direction that we all want to go. So, Prime Minister, I must say that in addition, we have also engaged the National Parenting Support Commission, which provides assistance to parents in these difficult times. And we've also had 32 helplines operating across the island, 2 per parish and 4 in Kingston and St. Andrew. Hotline numbers will be in place next week, and that will also assist in conditioning the children to be able to cope more effectively with the whole crisis that they are confronted with. And finally, the independent schools have reached out to us, and they have requested assistance because they anticipate a decline in the total attendance at school and the membership of their total school body. And we have indicated that the Ministry of Education will share learning material and techniques with the private schools. We believe that working together we can even bolster the basis on which they provide the kind of education that they have sought to do. So, basically, Prime Minister, all is going fairly well. You don't hear much about education these days, and that is an indication of the level to which it is operating quite efficiently. Thank you, Prime Minister.
Thank you, Minister Samuda. Just a couple of things. I want to kind of situate the minds of Jamaicans as to where we are in the epidemic. The Minister of Health has reported, if we could get the graphs up, that we have 30 cases. But it is important that we understand what is happening around the region. So you can see that we have been progressing in the epidemic. Approximately, this would be day 17, and we have put up the new cases, which are the blue bars, and you will see that we have a fairly leveling off of new cases, but still progressively increasing. And the red line represents the accumulated cases. That is the total number that we have tested and confirmed. And so we are now at 30 as at today's date. Of course, other tests are still outstanding to come in, so tomorrow you will get a different number. If we move to the other graph, which gives us a very good indication as to what is happening regionally. Now, it looks very complicated, but I'll take you through it very quickly. We have selected countries within the Caribbean region, and we have selected 2 countries from Asia and the United States. The Dominican Republic was the first country in the Caribbean to report a case, so they are the farthest ahead. They are approximately day 27 or so in the outbreak, and they have, if I'm reading correctly, somewhere in the region of about 540 cases thereabouts. Then you would have Costa Rica, which would be about day 20 in their outbreak. And I'm seeing that they have somewhere in the region of about 230 cases, if I'm seeing that correctly. Trinidad and Tobago, they have 65 cases. They are behind Jamaica. They are at about day 15 or day 14 in their outbreak. Panama has over 600 cases, 674 cases, and they are at about the same as Trinidad in terms of their period of outbreak. So Trinidad, Jamaica, and Panama are all about in the same phase of the outbreak. And of course, Barbados is that 24 cases. They are rising fairly rapidly. But just looking at the graphs, you will see that Barbados has a steep rise, Panama has a very steep rise, Trinidad had a jump but seems to be leveling off, Costa Rica is rising, the Dominican Republic is rising, but Jamaica is having a fairly flat curve with 30 cases. And Jamaica is tracking very closely what is happening in Singapore. Now, I want you to pay close attention to Singapore, because Singapore has implemented similar measures as Jamaica has. And they are at about day 63, 64 in their own outbreak, and they are experiencing a spike which is caused primarily by Singaporeans returning home with the disease. You can see that the United States, they went for a fairly long period very flat in terms of confirmed cases. Now they are having a spike with over 100,000 cases. You would see as well that Singapore spiked, South Korea spiked, but now they have managed to level off. The point I'm making to Jamaicans is that we are in the very early stage of the outbreak, that we probably will track Singapore, but inevitably, eventually, there will be a spike. What the government is trying to do is to ensure that the spike is not out of control, that the spike does not go beyond what our health system can adequately address. What are the things that could cause our curve to look like Barbados, Panama, Costa Rica, the Dominican Republic? Well, the main threat, as I said before, would be irresponsible behavior of our citizens. In particular, our citizens that have returned from overseas, our citizens who have traveled to countries where there is community spread of the disease. We know of cases, and we don't reveal names, we don't give any details. Health information always remains private. But I feel compelled to share circumstances so that the public understands that we have Jamaicans who traveled to, for example, New York, would have come back into the island, who would have been aware that they tested positive for COVID-19, and still interacted, gathered with, socialized with persons who are now traced, having to be tested, some of whom are probably now showing symptoms. One positive as a result of that action. Now that, in my opinion, is the heights of irresponsibility and almost deliberateness in action. It is, these kinds of action which cause a spike in the infections. We will never know about these irresponsible behaviors, and there might be multiples of them right across Jamaica happening right now, which we are only going to discover 3 or 4 or 5 days down the road when we see a huge number of cases coming to our attention because they are symptomatic and now having to be tested and then confirmed. And then you will see a spike. Now what that means is that we have to hospitalize them. And for every person we hospitalize, that's a bed that we are using. That's the nurses that we have to put in place. Now what happens to the people who we already have to treat with, who are just ill with normal things, with the hypertension, the diabetes? We have to be responsible. Yes, we know that there is a stigma that is emerging around the COVID-19. And the Minister of Health and everyone who has spoken has said there needs not be any stigma. What needs to happen now is that every Jamaican needs to be responsible. So if you know that you have traveled, and I'm appealing using this platform, you have traveled to a country within the last 14 days, specifically you have come into Jamaica from the 18th, please put yourself in quarantine. We have put up a website. I gather that when I announced it, there was so much traffic to it, the site crashed, but they have corrected that now. The site is up, and it will be displayed on the screen. Give us your information, self-report. Let us know what is your health status so we can help you if you are showing symptoms, so we can come and get you. Very important, very important. Let us keep our curve in Jamaica flat. Just to go back to the graph so that people see what I'm saying. Let us keep our curve flat. Notice Jamaica is the blue line. You can't even see it because it is flat. You notice that all the other lines are trending up. Let us keep our line flat. A couple other things I want to address before we close. There seems to be quite a panic about a shutdown. The government has to be very open and at the same time very cautious about how it treats with information, because there is a residual mistrust of government. And that is unfortunately the case, and we have to treat with that. In Parliament, I indicated that if our situation deteriorates in terms of the number of cases that we have to treat with, then a tool in our toolbox to treat with the epidemic would be a shutdown. We have not contemplated using that tool because the numbers don't justify it. We are in the phase where it is justified, but the numbers do not justify it just yet. If people behave irresponsibly and there is a spike, then the government would have to consider a total lockdown of the country. But at this point, that is not a contemplation. However, I also said that the public should prepare. And we can't share that information without understanding that there will be some panic, but there need not be any panic. People now need to be concerned, need to be aware, but importantly, people need to be prepared. So take your time and prepare. When I say take your time, I don't mean move slowly, but you certainly don't need to panic. I think we have been very upfront. We have shared all the information we can in the hopes that the public will take it in the best way and use it the best way possible. And as it relates to sharing information, we have come across this voice note falsely accusing the Attorney General of providing information that there will be a lockdown in Westmoreland. Now, that is the heights of public mischief, and the law covers that. And indeed, I have passed the voice note to the relevant authority, who advised me that they have been monitoring, and they have already picked up that voice note, and that very soon we will see some action. I say this because there is a sense that people can break the law with impunity. I think the AG would say there are those who are immune to the law. Well, let me tell you, we are going to enforce the law. We won't be able to enforce against everyone, but certainly those that come to our attention and those that we investigate and find evidence on, we will enforce. The Minister of Health informed me today as well that charges are going to be brought against those who stole. Well, they have been charged. 4 persons have been charged who stole the personal protective equipment, of which we are now hearing complaints, we don't have enough, we don't have enough. We don't have enough because our own people have stolen them. So we have to, at this time, it's a learning moment for our young nation. That if we're going to recover from this crisis and be stronger, then our public order and law enforcement must play a critical role in ensuring that all Jamaicans act responsibly. Ladies and gentlemen, thank you. questions.
Thank you so much, Mr. Prime Minister. Today we have on our Zoom platform several media entities, and the representatives will show on your screen, sir, along with questions from media and the general public on social media. Let's go to the media on Zoom, and we have from Nationwide, Brittany. Brittany, if you could, as you would when you are here, just identify yourself and certainly ask your question.
All right, can you hear me?
Perfectly, go ahead.
Perfectly.
Okay, thank you. Brittany Clark, Nationwide News. So I have two quick questions. The first one, approximately how many persons have arrived in the island between March 18 and March 23? And how far are we in the process of tracking those persons down in terms of numbers? And secondly, given the circumstances, is the government of the view that self-quarantine protocol is not being observed by citizens of the country?
Well, I'm going to decline answering the question as to how many Jamaicans came in. That number, we discussed it at Cabinet, but we're still just trying to make sure that we have the correct number. But it would be in the region, it would be over 2,000 that would have come into the island. The exact number we will disclose at a later stage, probably when we give out all the flight numbers, then we will disclose that number. Your other question would be about whether or not the government believes that the protocol is working. I would ask the CMO to answer that question.
I believe that the numbers that we are seeing presently in terms of the 30 confirmed cases, and I believe 18 of these are imported, 21 of these are imported cases. So the majority of cases that we're seeing are imported cases. And we've had 9 contacts. So that suggests that yes, some persons are staying home and are sticking to the self-quarantine. As a matter of fact, as time has gone by, in the interviewing of the persons that are positive, we have found a better response, because we have found that the traffic in terms of their movements in most of the persons, the latter persons that we have picked up, has been less. It can get better. It can get better, and at this time, this is what it is going to take for us to break the transmission, for persons to be more vigilant, in staying home, and especially, as the Prime Minister mentioned, those persons that came in since the ban on the UK. After that ban, we had a lot of persons that have come in from other countries that were not included in the ban, and then we had a lot of other Jamaicans that have come home. So we really need to make sure that they stay home. So yes, I think that it is working, short answer, but I think it can work better, and I think we can do a lot more.
Thank you.
Thank you, CMO. Prime Minister, up next is the Gleaner. Let's see. On the Zoom, we go to the question from Zoom. Yes, go ahead.
Let me clarify. We are in uncharted waters. Constitutional questions will arise. We expect them. We have raised some of our own internally. Do you think that we really would embark on an action that we consider unconstitutional? Come on, come on. Opinions will differ, and the debate will rage and continue to rage. And I do believe that some of these questions will only properly be answered in the court that is entrusted with interpreting the law. But right now, the actions we take, we're of the view that they are legal and constitutional. And we're very aware that views will differ. And until such time, we will do whatever is required within the bounds of the law to protect the people of Jamaica.
So not to add to what the Attorney General has said, but I think an interpretation of what the Cabinet has done is to look at the options available for action. And what we have done is to select the best options that we believe, based upon our interpretation of the law, that we can most quickly operationalize. And so it is, in our minds always, it is we have an emergency, we need to get a particular result, we have to obey the law and the Constitution. Within those options, what are the quickest ways to get it done? And, the cabinet is, it's like our brain, we always second guess, we always seek other opinions, but at the end of the day, we come to a decision and then we act. So we're just sharing with you that the cabinet does not operate in a monolithic way. We are always ruminating on the facts that are placed before us.
All right, again from Zoom, the media is really just on Zoom, so let's just have them there. This from JNN. Identify yourself, kind sir.
Hi, I'm Michael Sharp from Jamaica News Network, JNN. Mr. Prime Minister, you say we should prepare for the worst, but at the same time, don't panic. Can you assist us in terms of your modeling? While our curve is relatively flat, what are your numbers showing? When would you, for example, go the route of say, now let's lock it down?
So a very good question. I have been very reluctant in sharing the modeling information. The Minister of Health has told me that it was shared before, and I'll allow either the Minister of Health or the CMO or the representative of the Minister of Health to, if they choose, to say what the numbers, what our models are. My own reservation in sharing them is that they are used responsibly, because you could share these numbers and then someone says, see, this is what you predicted, but it didn't happen. These are our best perspectives. They are our best assessment, but they do not represent what will happen in reality. So I'll ask the Minister of Health if you so wish.
Thank you, Prime Minister. So in terms of using responsibly, I want to reiterate that. But the modeling that was done with the team, led by the Chief Medical Officer, was done on the basis, and our epidemiologist, Dr. Webster Carr, was done on the basis of the 2008 H1N1, 2009 H1N1 outbreak. And currently in the country, we expect the public health system, well, public and private, to deal with about 1 million cases of respiratory ailment, flu-like symptoms. The modeling that was done suggested that we could see an additional 1 million to 1.5 million cases, which would take us up to 2.5, 2.6 million. Now, it's important, though, that that number doesn't scare the population, because the vast majority of those persons affected will be mild, easily treated, no need for a doctor, the multi-symptoms, the rest, the juice, and they'll be back up and running. And the evidence suggests that across the world, as it relates to this particular virus, in terms of the numbers that actually pass on from the virus, very minimal. I think it's now at 2.5% of those who are affected globally. But of those numbers, we had projected that about 400,000 would end up in our public health system. And of that number, approximately 2,000 or thereabouts would be serious enough to be hospitalized. And of those numbers, about 350 to 400 would be severe enough to require high dependency or ICU care. And that's where pneumonia would be the sort of common ailment, which of course, depending on your underlying condition, your age, your immune system, could result in fatalities. So we start with a very large number, but it gradually comes down to a relatively small number, but enough to create significant challenges for persons who are not prepared. And we are preparing the health system to deal with those numbers.
Thank you, Minister. Prime Minister, it's 2 minutes past 8 o'clock on a Friday evening. I just have a few more. I know Alicia Dunkley is waiting from the Observer in line. Let me just quickly go to Twitter for you. Sanjay Lewis from Power 106. I think the SMO might have spoken to it, but he's still asking, is there a plan to increase testing? And also from Twitter, Emily Crooks is asking, in light of the UK Prime Minister and others in government in the UK having tested positive for COVID-19, and your orders, Prime Minister, for people to work from home, when will you start working from home?
I plan to work from home today, but so we are thinking about a protocol about whenever there is a crisis, there is an element of the crisis which is leadership. And leadership has to think about the continuation of government, the continuation of the entity, the continuation of the enterprise. So even for us as members of parliament, cabinet ministers, we have to think of a protocol. The Ministry of Health has a protocol where they rotate, they allow critical leadership to take a break, refresh, and come back. Yeah, I hope you are following the protocol strictly. And we in the cabinet will have to be following, yes, we will have to be following that protocol. We started last week where we had our virtual meetings, and we intend to continue with those virtual meetings. I certainly will have to be in office on Monday. Tuesday, I'm planning to work from home. Wednesday, I'm planning to work from home. Thursday and Friday, we may be back in the office. So yes, I too am taking off and working from home. The Minister of Health, I will place him under quarantine if he doesn't take a break.
Thank you, sir. Let's go to Zoom. Alicia?
Thank you. Alicia here from The Observer. I heard just now that there were contemplations for the police to further be used as it relates to tracking the individuals who have come into the island between the 18th of March going onwards. There have been concerns raised by the Police Federation as to the strain on the members. During your contemplations or discussions today, was that an issue that came up? Was there anything that you spoke about that you would want the public to know?
Certainly.
As it relates to police and the resource?
Yesterday, we had our National Security Council meeting, which, we have been very disciplined in having our National Security Council meeting. We have not missed a month that we haven't had that meeting. And we spent almost all the time discussing the response of the security forces, and quite a bit of emphasis was placed on the response of the JCF. The commissioner informed me that he has trained a number in the hundreds of officers to specially respond to the COVID-19 threat, and that special response would be the necessary gears and the necessary protocols as to how they would treat with it. I couldn't tell you whether or not that number is sufficient and how well dispersed they are around the island. I'm certain that the JCF at some point will give an indication. As I said earlier in my presentation, in treating with the crisis, law enforcement and public order will be critical to us coming out of the crisis. And when we're talking about law enforcement and public order, it is the JCF. Now is the time when we will have to rely on the JCF. We, however, cannot place our men and women at risk without providing them, first of all, with the proper gears and with the right training and standard operating procedures to allow them to effectively execute the tasks assigned to them. So we are not saying that the police by themselves will be asked to do this. Certainly they would have to do this in conjunction with the health officials and at the direction of the health officials. But since you have raised a question, let me repeat. We have asked the police to scrub the manifests that are there, pick up addresses that we have, to work with the Ministry of Health, to visit addresses, to see whether or not these addresses are suitable places for quarantine, and if the persons are there, to track and trace them, and if they are not observing the quarantine, it would be the discretion of the Ministry of Health and the officers to either warn or charge or place in state quarantine. If we go a second time and there is still a non-observance of the quarantine protocol, then definitely charges will be laid and those persons placed into quarantine, state quarantine, and the enforcement will be at that point complete.
Thank you, sir. We've done Zoom, we've done Twitter. Let's go to our last two questions then from Facebook. Justice is asking, has anyone left hospital who's recovered? And finally, the final question, sir, why not ask the airlines to release names of the arrivals in Jamaica in this temporary public matter?
Okay, so on the first question of anyone being released, no, but we do have a number of persons, I think numbering about 4 persons who are now asymptomatic. In other words, they've passed through the worst. 6 persons who are asymptomatic. So they have passed through the worst. They're not showing the signs, the coughing, the sneezing, the fever, and so on. There is a protocol for releasing these individuals, and the protocol is simple. 2 negative tests within a 48-hour period. So you do a test today. If it's negative, you wait 2 days, you do another test. If it's negative, then they are released. We have done a few tests on these individuals, and they have come back positive. And as a consequence, we have to hold them. I want to ask for 10 seconds to say it's part of the dilemma that we face as it relates to a holding area, which is why we need these rooms, because the clinical theory on a person transitioning from being ill to being well is based on getting that negative test. During the asymptomatic period, when they are not showing the signs, they are termed in medical jargon to be shedding the virus, which makes them highly contagious to persons they come in contact with, even though they show no symptoms. And I'm told that that could go up to 30 days. So we have to find somewhere to house them while they are shedding so that they do not contaminate other persons. And that is why we need these transition facilities, if you will, because otherwise we have to keep them in the hospital, in isolation, which takes up the space for others who really need it to occupy. So we have these 6 persons who we will test again, I believe, in another day or 2, and we'll keep doing that until they are able to be released.
Does that also cover the airlines issue?
Oh, for the airlines, we are very careful about releasing personal information in this time. There's many legal implications around that. However, if it is assessed, if we do take a careful assessment of it and we see that this is the only option, then it may be something that we would consider. But we will not release the names just yet or right now. What we will do, however, is to release the airline, the flight numbers, and the dates that the flights have come in, and ask the public vigilance and support to help us in identifying persons who have returned to the island on the flights that we have put in, on the dates that we have announced, and who are not maintaining quarantine.
Sir, there are 2 questions that were submitted long before. I'm just seeing them concerning, is the government considering a reporting hotline for persons who know of others not observing the quarantine order, coming from the Gleaner earlier? And 18 degrees north, Ms. Zara Burton is asking, is dizziness one of the symptoms of COVID-19? Apparently she's saying that there is some miscommunication with what is on the hotline and what she understands symptoms to be. So those are the last 2 questions.
Well, as it relates to whether or not we have a hotline up, yes, we do have the 888 One Love. We also have emails. It's COVID-19 at moh.gov.jm. So we would appreciate the information from the public, particularly if you were to use the email because that doesn't have the level of congestion as the calls to the line. So just to repeat, it is COVID-19, all one word, at moh.gov.jm. And of course, if you have traveled and you are in quarantine or not, please send us that information on jamcovid19.moh.gov.jm. On that website, there is a form. Fill that out. Give us all the information so we can work with you. Let us work together in ensuring that we keep Jamaica safe and we have a strong fence around COVID to keep COVID out and to keep us safe. Minister, you want to address the question of the dizziness or maybe the...
I just want to say to members of the public that we are working out some of the kinks with the hotlines in terms of for persons to get medical attention, all right? When we define an infectious disease and we're looking at surveillance measures, then we are going to say what are the commonest symptoms. But symptoms vary in various populations. You have the elderly population who will respond differently. You have the very young who will respond differently. So if somebody is having symptoms and have a contact history, and when I say symptoms, if they're having any symptoms, and they have a contact history or a travel history, then it is important that we direct them from the hotline to speak to a doctor. So I do recognize that I have received the calls myself, and I have seen that there are some deficiencies in terms of that referral process, and I'm hoping that within the next few days we will be able to sort that out so that any persons who would be at risk of an exposure who have symptoms, we can at least have a discussion with them to speak about those symptoms and see if it is in fact relevant to COVID.
So CMO, you're saying that dizziness may be, but it is not one of the common symptoms.
It's not one of the common symptoms, but they should have a discussion with a doctor.
Yeah.
So that's what we need to sort out to make sure that anybody who's having symptoms speaks to a doctor, because it may be an elderly person who would have had that travel history or had a contact history, who maybe have a first.
All right. So dizziness by itself could not be said. Would not by itself. So you'd want to look at, first of all, a contact history or a travel history or something that defines the risk of exposure. And then on top of that, any symptom would then need to be investigated. Ladies and gentlemen, it was a great pleasure. Thanks for joining us. Thanks to the media. Thanks to my team here. And again, thanks to the men and women of our health services and our security forces who literally are on the front lines of this battle. Thank you very much, ladies and gentlemen.